Have you noticed your older cat eating constantly but still losing weight? Maybe they're more restless or vocal at night or acting like they can't settle down. Maybe they're having hairballs or vomiting more frequently but still eating and acting normally. Or maybe your veterinarian mentioned hyperthyroidism and now you're trying to understand what that means. This is very common in older cats and it's often very treatable once diagnosed. Today, we're going to break down what hyperthyroidism actually is, why it happens, and what treatment looks like. I'm Dr. Matt Clark with Class and View Veterinary Clinic, and this is Beyond the Vet Visit. Before we get started, I want to remind you that this video is intended for educational purposes only. Every cat is different, and this information should not be considered a diagnosis or a substitute for professional veterinary care. If your cat is losing weight quickly, eating excessively and not gaining weight, vomiting repeatedly, acting restless, collapsing, having trouble breathing, or seems suddenly unwell, please seek veterinary attention immediately. The goal of this channel is to help you better understand what your veterinarian is seeing and recommending so that you can feel more informed and confident about your pet's care. So what exactly is hyperthyroidism in cats? At its simplest, hyperthyroidism is a condition where the cat's thyroid glands produce too much thyroid hormone. The thyroid gland is a small gland in the neck that plays a big role in controlling the body's metabolism, basically how fast or slow the body runs. You can think of it like a control dial. When everything is working normally, it helps keep the body's energy levels balanced. But in hyperthyroidism, that dial gets turned up too high. As a result, the body starts running in overdrive. The heart beats faster, calories burn quickly, and the body works harder than it should just to keep up. That's why many cats with this condition lose weight even though they're eating well or sometimes even more than normal. So why does it happen? In most cats, hyperthyroidism is caused by a benign or non-cancerous growth in the thyroid gland called an adenoma. This growth causes the gland to produce more thyroid hormone even when the body doesn't need it. We don't always know exactly why these changes develop, but we do know it's really common in older cats, especially those over the age of 10. The important thing to understand is that it's not the body failing in a sudden way. It's more like a control system gradually getting stuck in the high position. The good news is that once it's identified, hyperthyroidism is very treatable, and many cats respond extremely well to therapy. So what does hyperthyroidism actually look like in a cat at home? One of the most common patterns is a cat that seems to have a really good appetite, sometimes even increased, but is still losing weight. Many owners describe it like this: my cat's eating all the time, but they're getting thinner no matter what I do. Along with weight loss, you may notice other changes, such as increased appetite or acting constantly hungry, more energy, restlessness, or seeming unable to settle down, increased vocalization, especially at night, vomiting or softer stools in some cats, or a coat that looks unkempt or greasy over time. Sometimes you might even see increased thirst or urination. Some cats just start to feel a little different. They may seem more active, more demanding, or less predictable than they used to be. Now here's the important part and why this condition is often missed early. Hyperthyroidism usually develops slowly, especially in older cats. Because of that gradual change, it can be easy to assume that what you're seeing is just normal aging. For example, they're just getting more vocal because they're getting older. Or maybe they're just eating more, so they must be doing well. Weight loss is just a part of getting older. And because cats are very good at adapting, they can often continue acting mostly normal at home for quite a while, even while the disease is progressing internally. By the time hyperthyroidism is diagnosed, many cats have already been living with it for a long time. The good news is that once it's identified, it's usually very treatable, and many cats respond well with appropriate management from their veterinarian. So, how do veterinarians actually diagnose hyperthyroidism? In most cases, it starts with a combination of what we're seeing at home, a physical exam, and blood work. During the exam, your veterinarian may notice weight loss, a higher heart rate, or sometimes even feel a small firm swelling in the neck area where the thyroid gland sits. But the most important part of diagnosis is blood testing. We look at a hormone called T4, which is the main thyroid hormone produced by the gland. In cats with hyperthyroidism, this level is typically elevated above the normal range. In many cases, a clearly high T4 level confirms the diagnosis. However, One important detail is that early or mild cases can sometimes have borderline results, meaning the level is still within the upper part of normal, even though the disease is starting. Sometimes this can occur due to your cat being what's called euthyroid sick, where other illnesses or stressors can actually make the thyroid level look lower than it is. That's why your veterinarian may recommend repeating the test or running additional thyroid-related tests if they still strongly suspect hyperthyroidism. It's also very common for your veterinarian to recommend additional lab work at the same time, because hyperthyroidism can affect other organs like the heart and the kidneys. So diagnosis isn't just about one number, it's about putting the whole picture together: symptoms, exam findings, and blood work. Once hyperthyroidism is diagnosed, the good news is we have several effective treatment options. The best choice depends on your cat, your situation, and sometimes your goals for long-term management. One of the most common treatments is a medication called methimazole. It is FDA approved as a pill and a liquid, but can also be compounded in other forms to make it easier to give your cat. This medicine helps reduce how much thyroid hormone the gland is producing. It doesn't remove the disease, but it does help control it. Most cats take it either once or twice daily, and many do well on it long term. Because it affects hormone levels, your veterinarian will typically monitor blood work regularly to make sure that the dose is correct and your cat is tolerating it well. Another option is a special diet that is restricted in iodine. Iodine is needed for the thyroid gland to make hormones, so limiting it can help reduce hormone production. The important thing to know is that this diet has to be very strict. That means no other food, treats, table scraps, flavored medications. Otherwise, the treatment may not work as intended. I do also want to let you know that sometimes even with diet, it's possible you'll need other treatment in order to fully control the hyperthyroidism. Radioactive iodine therapy is often considered the most definitive treatment. It involves a single injection that targets and treats overactive thyroid tissue. The goal is to restore normal function, often without the need for lifelong medication. It's very effective, but it does require referral to a specialty facility and a short period of isolation afterwards because it's radioactive. While this is technically the best treatment, it's not always feasible, both monetarily and in being able to find a specialty center close to you who performs it. The important thing to understand is that hyperthyroidism is treatable. Some cats do best on long-term medication, others do well with diet, and some may be candidates for a more permanent solution. The right choice depends on your individual cat, their overall health, and a discussion with your veterinarian about what makes the most sense for your situation. Once a cat is diagnosed with hyperthyroidism and treatment is started, the next step is monitoring. This is not a condition where we can just start treatment and never look back. Instead, it takes some time to follow up and make sure that treatment is working correctly and that your cat is feeling their best. Your veterinarian will typically recommend periodic blood work. This helps us make sure the thyroid hormone levels are coming down into a normal range and also helps us monitor other important values like liver and kidney function. This part is really important because every cat responds a little differently, and sometimes the dose needs to be adjusted over time. Also, as it's caused by a benign growth, as we discussed earlier, the disease can progress over time and require more medication or treatment. In many cases, you'll also notice changes at home that can help guide us, like the appetite may start to normalize. Weight loss should slow down and eventually stabilize. Energy levels may become more balanced. Restlessness or vocalization may decrease. The goal is not to slow your cats down too much. It's to bring their body back into a normal, healthy balance. So why do we treat hyperthyroidism if it's so common in older cats? The simplest answer is that untreated hyperthyroidism doesn't just affect weight and appetite. It affects the whole body over time. When thyroid hormone levels stay too high for too long, the body's essentially running in overdrive every day. One of the biggest concerns is the heart. The increased metabolic demand forces the heart to work even harder and faster, which can eventually lead to changes in muscle function and high blood pressure. Hyperthyroidism can also mask other underlying conditions, especially kidney disease. When the body's running too fast, kidney values on blood work can actually look better or worse than they really are. Once thyroid disease is corrected, hidden kidney disease may become more apparent, or elevated values might go away. Over time, untreated hyperthyroidism can lead to weight loss, muscle loss, weakness, decreased mobility, increased stress on the body's organs, a lower overall quality of life, and others. The good news is that treatment is very effective in most cats. and many cats actually feel significantly better once their thyroid levels are controlled. They're calmer, more comfortable, and more stable in their day-to-day routine. So the goal of treatment is not just to improve lab numbers, it's to protect long-term health, support organ function, and help your cat feel like themselves again for as long as possible. There are a few common misconceptions about hyperthyroidism in cats that can make things more confusing for pet owners. Let's clear some of them up. My cat's eating a lot, so they must be healthy. This is one of the most common misunderstandings. While a good appetite is usually a positive sign, in hyperthyroidism it can actually be the opposite of healthy. In these cats, the body is burning through energy too quickly, so they feel constantly hungry, even while losing weight. So, increased appetite doesn't always mean everything is working well. Another one is weight loss is just normal aging in older cats. It is true that older cats can change over time, but weight loss is never something we should just automatically assume it's just aging. In fact, unexplained weight loss is one of the most important early warning signs of hyperthyroidism and several other medical conditions. The key message is that aging can explain some changes, but it should never replace a medical evaluation. Another is if my cat seems normal at home, can't be serious. Cats are good at hiding illness and adapting to gradual changes. With hyperthyroidism, many cats continue eating, walking around, and acting normal for quite a while, even while the disease is progressing internally. So a cat can look mostly fine at home while still having a significant medical issue that needs treatment. Another is one normal blood test means my cat is fine. Early hyperthyroidism can sometimes be subtle, and in some cases, blood work may be borderline or even appear normal at first. That's why veterinarians interpret lab results alongside the symptoms and may recommend repeat or further testing if it still doesn't fit. A single number is helpful, but it's not the whole picture. And remember, your cat's condition can change over time due to progression of the growth in the thyroid. So, let's bring everything together. If there's one thing I hope you take away from this episode, it's that hyperthyroidism is one of the most common conditions we see in older cats, and it can have a big impact on how the body functions over time. We learned that it happens when the thyroid gland produces too much thyroid hormone, how signs can be subtle at first, and why it's so easy to mistake changes for normal aging, how your veterinarian diagnoses hyperthyroidism using a combination of exam and blood work findings, and especially by measuring thyroid hormone levels. And importantly, we covered the fact that there are several effective treatment options, including medication, diet, and radioactive iodine therapy, all aimed at bringing thyroid levels back into a healthy range. We also talked about why monitoring is so important and how untreated hyperthyroidism can put stress on the heart and other organs over time, even if your cat still seems fairly normal. The encouraging part is that most cats respond very well to treatment, and many go on to live comfortable, happy lives once their condition is managed. If you're noticing signs like weight loss, increased appetite, vomiting, changes in behavior, especially in your older cat, don't wait to have them evaluated. Your veterinarian can help determine whether hyperthyroidism or another condition is involved and guide you through the best next steps for your cat. If you found this episode helpful, please consider liking the video and subscribing to the channel. And if there's a veterinary topic that you'd like covered in a future episode, leave it in the comments below. I'm Dr. Matt Clark. Thank you for joining me, and this has been Beyond the Vet Visit. I'll see you next time.